Hello and welcome. You're watching Inspire India here on Mirror Now. I am Afrida Rahman Ali. This is the show that brings you the stories of the good Samaritans, those who are serving humanity in the middle of these unprecedented crises. We often forget to laud the efforts of those civil citizen groups, the community partnerships, the non-profit organizations who are doing their bit to close the gap between the need and the resources that are available. So clearly there are people who are working tirelessly on ground, just like the other frontline healthcare workers who we often acknowledge, but they are doing so silently on the sidelines. We often forget to notice them. So on Inspire India today, we are featuring two such organizations, community partnerships, civil society groups, whatever you might like to call them. Bangalore-based Need of the Hour, and we have two young enthusiasts joining us from this organization. Then we are also featuring Mumbai-based We Care Foundation that handles, again, shortages on the ground with men and machines, and emergency requirements are taken care of. I will just go right away and introduce my guests joining us today. First, I want to introduce the ladies on the show, Shriteja Ampar and Preeti Jain. Welcome to Inspire India. Thanks for joining us. So I'll begin with you, Shriteja. I want to understand from you.
Yes.
Okay, before I go to Shriteja, let me introduce the other guest as well. I'm so sorry. Dipesh Tang, who is joining us from We Care Foundation in Mumbai. Welcome to Inspire India. So coming back to you, Shriteja, I want to ask you to begin with that, we were talking about this earlier as well, that there are a lot of people around us who have faced personal loss and personal suffering. And I believe you lost your mother last month. But despite that, you have taken up this job along with your friend Preeti to help others around you in Bangalore. Tell us more about what does Need of the Hour do and how exactly are you able to help?
Well, first of all, good afternoon, everybody. And I would like to thank Mirror Now for actually creating a platform like this where you're showcasing individuals who are actually inspiring the society. And me as part of the Need of the Hour team, along with my friend Preeti, we're really privileged to be a part of this show. Just a little brief on what we are trying to do. Like we've discussed earlier on in the show, before the show, that Preeti and I have been going through rough times during this pandemic ourselves. And all around us, we've only heard people trying to find fault with the organizations, with the government, with the society, with the hospitals. What we thought is that we need to add value at some point and make some difference to the society. The main thing being here is we wanted to be the change that we want to see in the people. So we came up with this initiative. It was initially meant to be going on a personal level. We were just both of us who got together. There were a lot of volunteers in the background who came up and joined and teamed up with us. There was a WhatsApp group that we created. We were helping people with beds, oxygen, medical supplies, food, etc., etc. And then we identified that the need of the hour today is actually oxygen. So we thought we'll go ahead and create a facility with oxygen supply. And with the help of the local MLA that we approached and the authorities, like the BBMP and the hospital, Mahavir Jain, there was a vice president called Mr. Bhandari who helped us. And all of us together, we thought we will do it as a teamwork. So we came up with this COVID facility in the Koramangala Indoor Stadium, which is actually a tribute to teamwork. We wanted to show that, the BBMP, the government officials, the leaders, and the individuals can actually work together and make a difference in the society. I would let my friend Preeti actually give you a more insight on everything else that we tried to do with the initiative. Thank you, Afrida.
Yeah. Hi, thank
Preeti,
you.
go
Yes,
ahead.
no, stay on with us, Shriteja. I will speak to Preeti Jain as well. But
Okay.
yes, let me bring in Dipesh Tank as well. Dipesh, you
Sure,
apparently have
thank you.
spent over a decade in the development sector. And you were telling me earlier as well that, when you see people, the migrant workers, and their pain and suffering, that is one thing that sort of pushed you or motivated you to take this up. Tell us the story of how you started and what exactly was that particular point in your life that you thought that this is what I need to do going forward.
Right. Thank you very much, Mirror Now, and Afrida, for inviting me on this show. Yes, I do agree because migrant workers are the backbone of our country. They leave their homes, their families, they miss out on the best festivals. They're no less than, in my opinion, a soldier or a policeman. Who comes and is actually contributing so hard and so much into the economy of India. And times like these, they are just left alone. And there's nothing else to do because there's no official contract with their employers. And because the employer is not making money and migrant workers are left alone. And as a citizen of this city, Mumbai, I see and I feel that this is our responsibility to make sure and take care of our fellow brothers and sisters, migrant workers who are working in the most grassroots of that. You go out in the night at 1 o'clock, you will find only a migrant worker who will be driving an auto rickshaw or probably doing some work on the road, trying to fix the infrastructure of our city. And times like these, it's important for us to stand behind them and see how you can, if not solve their problem, but even lesser their anxiety or their suffering.
Yes.
Am I audible? Hello?
Okay, I think there's some disturbance.
Yeah.
I missed the last part of what you were saying, Dipesh. Anyway, I'm going to go back now to Preeti. Preeti, again, welcome to the show. I heard from your friend who I was talking earlier that you have recovered from COVID yourself. You went through the whole ordeal. And what you saw during that period, if you can share with us, and where did you find that there are gaps in the system where you can pitch in and help, Preeti?
Right. Thank you so much. Thank you, Mira, now to have us. I remember when we were tested positive, my entire family was tested positive. My husband recovered and I had my saturation level dropping a little low, uneasiness. Trying to get all our influence pulled together, we still couldn't get myself a bed for oxygen bed, not even an ICU bed. While we had gone to get myself tested for a CT scan, I remember waiting for good 4 hours and people queued up there. There were people in ambulance waiting out. I personally saw someone losing their life just in the chase of gate, at the gate waiting for getting a bed. And I told myself, I hope I recover. And if I do, I don't care. I'm going to do everything in my capacity to make sure that we are able to at least provide people oxygen at the right time so they don't go critical. And then we straight don't lose them. And that's what happened with COVID. There is no gray. You drop your saturation and then it becomes critical and then you're no more. And it was so painful to see all of this. And we decided, and Teja was the best person I could because she started a facility herself in Delhi. I reached out to her. And another thing, while we were in the process of putting a facility together and we raised whatever funds that we were trying to raise, people got to us to arrange beds for them, to arrange medicines for them, to arrange oxygen for them. And knowingly, unknowingly, we formed another team with our volunteers to get that rolling. And the situation was really, really damaged beyond control.
Yes, and we are looking at those pictures right now, Shri Teja and Preeti. We are looking at that 200-bed COVID facility that you are looking after, of course, with the help of local authorities. Shri Teja, are you able to get enough assistance? When it comes to something like this, it's a huge responsibility. Let's face it. I mean, if you have decided that you're going to take care of these many patients, take them under your wings. You're 35-year-old. I don't believe you have great amount of experience handling something like this, Shri Teja.
Of course, yeah. That's where we were actually very comfortable to doing it with the authorities like the BBFP and the local MLA, and also with the help of some of the medical facilities from the Jain Hospital. We have a very senior person who's been managing COVID, actually, Mr. Bhandariji, for about 14 months. He's constantly been involved with COVID activities. So he's there with us on the background. And secondly, the facility, the authorities have been really, really supportive. We got this facility rolling in 2 days. The Joint Commissioner, the South Zone and the Health Officer, they've made sure that all the facilities are in place for us to start. We've donated 20 oxygen concentrators and they came ahead to donate about 23 themselves. We first went and approached, we said, oh, there's an isolation center here. And maybe just needs oxygen put in there so people can actually benefit. So they picked up on our idea as well. That was part of their plan too. But since we came ahead and said, oh, we're going to give you the 20 and we're going to get more coming into you, they put in 23. They allotted about 10 doctors. We started the facility actually yesterday, Afridi, and I must say we've had 16 patients already come in there, and we've referred 3 to other facilities. So the doctors there are also very experienced. They're in direct contact with the BBMP war room. So yeah, the facility is very much in control at the moment. Yeah, thank you.
Yes, it's something important. You know why? I'll just point this out as well. Only today we are reporting, my colleague Srija, in fact, is reporting about how there is a huge crunch of beds in the government hospitals of Bengaluru. So this is where this kind of public participation and efforts from the likes of you and Preeti really help to, somehow ramp up the medical infrastructure, not leaving it entirely on the government to do it, but, trying and help and coming forward with the kind of resources, whatever you can manage. We will talk about how you get the funds and the resources again later. Let me talk to Dipesh as well. In Mumbai, Dipesh, now we are saying the situation has improved, but it has improved perhaps because of efforts of people like yourself who pitched in at the right time. From your observation, what are the areas that the city still needs help to recover fully, Dipesh?
Right. And it'll be unfair to say only people like me, but there are innumerous people like me who are there, like, from the team Khana Chahiye, and there are so many innumerous organizations who are contributing. So I would say I'm just speaking on all of their behalf. So thank you very much for that. But yes, things are getting better. The cases, the number of cases are going down. The infection rate is going down, which is a great thing. But we are just heading towards something much bigger of a problem, which is where the daily wage workers or the migrant workers who have been convinced to stay here because this is not going to be very long, is what we've been told them. And immediately they need to get back and start earning, because right now, if lockdown gets anything further than what it is right now, then chances are that most of them won't have food to eat because they won't have the money. They've almost spent out all the money that they had, that they were earning every day. Like, there are so many people who earn and live their life by day-to-day earnings. So things like this, I think, I'm sure our government has also said they're going to be providing some food grains and ration, but I don't think that's going to be sufficient enough to spread it across to so many people living in Mumbai city, especially the migrant and the daily wagers. So I think that's where we as a citizen should intervene and come forward and say that, there are times where government may not be at every place. So as a citizen, we'll try and take space and see if there is somebody who needs help, we can stand up and support them.
Yes. While doing so, Dipesh, first of all, tell us how many people are involved with you in your team, and also tell us how do you maintain your own health and safety standards? Because once you talk about doing something out there, reaching out to people, distributing material, there's a human-to-human contact which becomes inevitable, but then you have to also, of course, minimize that. How do you manage?
Absolutely. So last year we've been. I work full time for a foundation called We Care Foundation, which is largely into supporting migrant people who come for medical help in Mumbai city, and they are largely supporting cancer care related help. So, and they're also helping these cancer patients who come from in Mumbai to help and giving them basic medicines and food grains and many other things. But apart from that, I also work and volunteer for other organizations like Khana Chahiye, or individually, like somebody calling me for help, whether it's plasma, whether it's food grain, whether it's I'm stuck here, give me some money to transportation. So as and how you can come and help and contribute is what the primary objective is. Coming to your point on how do you take precaution, we take the uttermost precaution, because last year I got COVID in September, and it was not a very, very pleasant thing, to be very honest, because my father and my mother and all of them were COVID positive. So we do the maximum precaution, like, there are gloves, there are face masks, there is, you ensure I'm taking the right amount of vitamins, multivitamins, vitamin C, zinc, and all of these, just trying to keep ourselves not fall ill. But at the same time, I also feel that the government should recognize the work. And I'm not saying me, but there are many other people doing much larger work than I am doing. to at least consider them as essential worker, because we are doing the job of government in a way. So if they give us the vaccine, and if we can go out more openly and do the work more intensely, that's the intention. And I hope people understand the government's.
Oh, that's
and I'm
so
sure they have
important.
more
I'm glad you pointed that out. In fact, let's put that message out loud and clear. What Dipesh is saying, that those civil citizen groups who are working on ground must be on priority vaccinated, because they're risking themselves. And the reason why I asked you that question on, how do you take care of your health and safety, is because a lot of us might want to do something like that, but we get worried for our own safety. And therefore, that's why we call these stories of courage and fortitude, because it takes a certain amount of courage to go out there when you know there is a raging pandemic.
And I want to say this,
I want to ask you the same question. Preeti, to you first.
Yeah.
Okay, please complete quickly.
No, I'm saying that it's not like, I am scared. Like, it's not like I'm no hero. I am no superhuman being, but I do get scared stepping outside, like, to help, even to assist somebody. But I don't know who else is doing this, or how many of us are doing this. So yes, and that's where I feel that if government understands and gives us the kind of support that people like us need, it will be like really
that's
great.
why I said, and that's why I put out that message, that let's have these good Samaritans, the philanthropists vaccinated on priority. They are as good as any other frontline worker for us. So Preeti, coming back to you, you suffered COVID also like Dipesh did. So didn't your family discourage you from doing something like this? That, why now again take a risk? Because even after you recover, the people are getting infected. Sometimes families discourage, people from going forward with these things, just fearing for their health and safety. Did you face that kind of resistance from friends and family?
True. So I definitely had my family, my parents and my in-laws telling me that I haven't yet recovered. And honestly, I felt physically it was like nothing short of delivering a baby, the kind of weakness we were left this time with this mutant. But fortunately for me, I have an extremely supportive husband who believed in the vision, what I had in my mind, who along with me saw how people were suffering. And like I said, when we began this whole process of raising funds, we also began a team who were helping people. We would get calls, we would get about 50 calls. And there was this one particular day, I think has been the darkest day. Every call literally that we tried getting a bed, we couldn't save them. And that night, I think my husband realized even more that, okay, there is a reason why we're doing what we're doing. But they have been concerned about our health. But, someone has to do this, right? Fortunately, unfortunately, I'm already tested positive. So my chances of risk are lesser than Teja or anyone else. And like Dipesh said, we also told to the government officials, at least the team who's involved on ground, they're putting themselves at risk beyond what we can even visualize or imagine. At least the least we can do is protect them to an extent that we can. And we did. Teja and I personally went and told the government officials, can we at least have them vaccinated, if not anyone else? They are as good as doctors without the degree on ground. Let's be honest, right? Doing every bit in their capacity to help and save people over there. So I definitely think, and one thing that really in this whole process made my heart so warm was to see the way people came together, irrespective who you are, where you are, what you do. The vision, the goal was common for everyone, whether it's a layman, whether it's someone who's a big entrepreneur or a big businessman, it didn't really matter. The ground was common. And that was amazing. The whole city came together. There's several groups working on this. And it's so good. We all were fighting and striving to save those lives on that particular day that came to us. So somewhere we saw mankind getting better. I must admit that.
So when two friends come together, and I think there's a saying in Hindi, ek aur ek 11. It's something like that. It becomes a potent force. Two women coming together, it's so inspiring. It's highly commendable what you're doing. And this is a 200-bed facility, which we are showing our viewers also. 500 people so far have got beds, oxygen, medicines, and food from the Need of the Hour organization. They already have 16 people admitted. Also, Shri Teja, isn't it a challenge? Because, we report consistently from the ground on how the hospitals, 20 now, from the hospitals about how there are no doctors and nurses in the government hospitals. So how do you plan to have doctors to attend to people who would be there in your facility, Shri Teja?
Okay, so coming to that, Afridi, we actually already have 10 doctors appointed there, like we've already mentioned. There were 6 and there were 4 yesterday who joined us. So yes, we are struggling a bit on the staff nurses, but our housekeeping and the doctors per se, we are sorted. And like we said, it's a team effort from BBMP. So if they can't provide us, we are looking to hire them personally with our own funds or with the funds that we are going to raise. So we have a team, medical team, who's helping us out on call as well. So we have that all sorted as of now. We're still looking for nurses to come in there because that's the concern. The need of the hour right now is, I think, like medical staff, which are staff nurses and also ICU beds. That is the main concern right now we're trying to address. But yeah, we are together and we're working on it, and we're willing to put in our own initiative, our own funds, and get it there to support the government. Because even if they give us 2 people and we hire 2 people, it'll still make the process much quicker for the patients and for the facility. And even if the local leaders are able to support us. So that's why this has to be a team effort. And that was a whole process that we actually initiated by meeting the need of the hour. We want everybody to come together. So anybody else who's willing to help us, who want to be a part of us, you're more than welcome to join us and support us in whichever way possible. Yeah.
Absolutely. Dipesh, one last word from you as well on the challenges that that a foundation like yours could face. Yes, there are many organizations, like you said, and this has again become a pillar of strength for the people of the city, because they know that there is somebody around there who might be willing to help, and you are one of them, that, giving that kind of support. And like you earlier also mentioned, the government cannot reach out to every last corner of the city. So you are doing in some way that last mile coverage, Dipesh.
Absolutely. I see, this is the right time for people to show their patriotism. Patriotism is not about abusing a country or religion or any of that sort. Patriotism is about loving your country. And times like these, when your country needs the most, not every time you have to go on a border and have a war with an enemy country. Corona is something that we have to defeat Corona. And for that, we have to come together and imagine yourself walking through the landmines, you're going to have casualties. It's a calculative risk that you're taking, but it is extremely important you take that step. I don't understand people are so at times not helpful to people who really need help and become really, really shut themselves towards suffering of somebody else. So I think times like this, we should come out and take calculative risk and help people who are in really need, and only to prove that if you really love your country, because for me, loving my country is taking care of my country. And taking care means I'm going to do whatever it takes. I will be law-abide. I will do whatever it takes, to make sure that somebody is on the street down there dying because he doesn't have an oxygen or an ambulance or something. I'm going to go and find a PPE kit and help that person and take them to the hospital as much as I can. So, the point I'm trying to make here is that let's not
It's a beautiful message. It's a beautiful message for everyone who's listening, that if you want to know what is true patriotism, I also believe what Dipesh said is true, that when you work for the people of this country is, after all, the people, right? And if you help them, that, of course, shows your true patriotic spirit. Thanks for that message, Dipesh, and thank you, Shri Teja and Preeti, also for joining us. It was an absolute pleasure having this conversation.
Thank you.